Hello and good evening. Thank you for joining the Los Angeles County Department of Public Health Mosquito-borne Disease Virtual Town Hall. This evening, we are joined by Dr. Ayman Halai and Dr. Dawn Terashita from the Department of Public Health and Jason Farnett from the San Gabriel Valley Mosquito and Vector Control District. We will begin with our panelists providing some brief opening remarks, followed by questions from you, the audience. If you have a question, you may enter it in the chat. To start, I'd like to introduce Dr. Ayman Halai. Please take it away.
Thank you so much, Brad. Hi, good evening, everyone. Thank you for taking out time to join us today for a discussion on mosquito-borne diseases. Thank you. Next slide. Mosquitoes can spread many diseases, including those that are caused by viruses and parasites. Different types of mosquitoes can carry and spread different infections, and you can see their names in the little arrows. Today, we will be focusing on two mosquito-borne viruses. Next, dengue virus, as it is causing large outbreaks around the world. Next, and West Nile virus, as this virus causes cases in Los Angeles County every year. Next slide. When a mosquito bites a person or animal that is infected, it swallows any viruses or parasites living in the blood. The virus or parasite then develops and multiplies inside the mosquito. The infected mosquito then transmits the virus or parasite through its saliva when it bites another person. Any disease that is spread in this way from a mosquito to a human or animal is known as a mosquito-borne disease. However, not all mosquitoes are infectious, and not all bites will make a person sick. Mosquito bites can become swollen, red, and itchy, as you can see in the picture, and this is because of a local allergic reaction to the mosquito's saliva. Next slide. West Nile virus is an important virus in LA County. As I said, it causes cases each year in our area. It is spread by the bite of an infected Culex mosquito, and we will talk about the different types of mosquitoes a little bit later. It belongs to the flavivirus family, similar to dengue, and transmission usually occurs in the summer and lasts through the fall, that is from June to November. Next. In this graph, you can see the number of cases of West Nile virus that are detected each year in LA County. And you can see that the number is highly variable. Over the last 5 years, we have averaged about 55 cases per year. But in previous years, the numbers have been higher than 300. There's no way to predict how many cases we will get. But what we do know is that cases will occur every year. And this probably is an underestimation of the number of people that are infected, because only the sickest people that go to hospital, get tested and diagnosed are captured in our system. Next. West Nile virus circulates in the environment between mosquitoes and birds. Some birds develop very high levels of virus in their bloodstream, and when the mosquitoes bite those birds, they become infected. When these infected mosquitoes then bite birds or other mammals, they pass the infection forward. Humans, horses, and other mammals do not develop the high level of virus in their bloodstream that is required to pass the infection back to the mosquito, and we refer to them as dead-end hosts. But because of the circulation of the virus in between the mosquito and the birds, it's really hard to eradicate West Nile virus activity from our environment. Next slide. Four out of 5 people infected won't have any symptoms from West Nile virus infection. 1 out of 5 people infected, typically 2 to 14 days after the bite from an infected mosquito, develop illness with fever and non-specific signs and symptoms, similar to influenza or a common cold. They'll have fever, headache, body aches, muscle pain, joint pain, nausea, vomiting, and may have a rash. 1 out of 150 people infected develop severe West Nile virus, which is also called neuroinvasive disease, which can present as meningitis, which is inflammation of the lining surrounding the brain, or encephalitis, which is inflammation in the brain itself, or acute flaccid paralysis, which is when the infection affects the spinal cord. Such patients can present with severe headache, sensitivity to light, neck stiffness, confusion, paralysis of the limbs, and also coma. 10% of the people who develop neuroinvasive disease will die from it. And there are several people who will have long-term complications from their infection. Those older than 50 years of age or with underlying medical problems such as hypertension, diabetes, chronic kidney disease are at highest risk of severe disease. Next. Dengue in LA County is primarily a disease of travelers. It is spread by the bite of a different type of mosquito than the West Nile virus mosquito, which is called the Aedes mosquitoes. Dengue commonly circulates in tropical and subtropical areas around the world. And travel-related cases are detected each year in LA County, particularly after summer and fall travel. And you can see the pictures of the types of Aedes mosquitoes on the slide. Next. So why should you care about dengue? Well, there are large dengue outbreaks occurring around the world. You can see some new snippets here with outbreaks in Brazil, Mauritius, Argentina. Next. In fact, in 2024, dengue cases in the Americas, which is Central and South America, have surpassed 10 million already. Many of these countries are just entering their warm and wet season, which means that there will be more activity and more cases. This is the highest number ever recorded, more than 2023, which was a record year on its own. In March this year, Puerto Rico declared a public health emergency because they are expecting a very large outbreak in their area as well. Next. Here you can see in the darkest color countries that have frequent or continuous dengue transmission. And you can see that it's very widespread around the world. Next. Following the same trend, we have had more travel-associated cases. So dengue diagnosed in returning travelers in LA County. The red line represents 2024 cases, and that's much higher than the blue line, which is 2023. Next, please. A person can get dengue more than one time. This is because dengue is caused by 4 distinct but closely related serotypes: dengue virus 1, 2, 3, and 4. Infection with one dengue virus will induce lifelong immunity to that specific virus, and only short-term protection against the other types of dengue viruses, 2, 3, and 4, for example, if a person was infected with dengue virus 1. What this means is that a person infected with dengue virus 1 can be infected with any of the other 3 dengue viruses, and that applies to all of them. Next slide. Most people who become infected with dengue are asymptomatic. 1 in 4 people will develop symptoms, typically 2 to 7 days after the bite of an infected mosquito. The symptoms are very similar to West Nile virus, as you can see: fever, muscle pain, joint pain, bone pain, nausea, vomiting, headache, pain behind the eyes, and rash. Approximately 1 in 20 people with symptomatic dengue will develop severe disease. Next. Severe dengue is a medical emergency. It can result in shock, internal bleeding, and even death. A second infection with dengue is a risk factor for severe dengue, although any infection can cause severe disease. Next slide. High-risk populations include infants that are less than equal to 1 year of age, adults older than 65 years of age, pregnant persons, and those with chronic medical conditions such as diabetes and chronic kidney disease. Next. So why do we care about dengue in returning travelers? We know that we have the mosquito that is capable of transmitting dengue present in LA County. Next. So let's go through a scenario. A person becomes infected with dengue abroad, comes back, a local mosquito bites that infected person, then that now infected mosquito bites another person that has not traveled, and that becomes a locally acquired case. Now, this person can pass the infection to additional mosquitoes that can cause more people to become infected. Next. This situation occurred in LA County twice last year. One in a resident in Pasadena and one a resident in Long Beach. Next. Here is a map showing the presence of the Aedes mosquito. The red dots is Aedes aegypti, and the blue dots is Aedes albopictus. And you can see that they're present almost in all areas of the county. Next slide. I will pass it over to Dr. Terashita to talk about treatment as well as prevention. Thank you.
Thank you, Dr. Halai. Unfortunately, there is no specific treatment for West Nile virus or dengue virus, and instead treatment is supportive. This includes rest, fluids, and pain medications, which may relieve symptoms. In certain cases, severe cases will require hospitalization, and some cases even require a more intensive care level of care to treat their symptoms. Next slide. Also, unfortunately, there is no human vaccine for West Nile virus, nor any dengue vaccine that is currently recommended for use in US travelers. There is a dengue vaccine called Denvaxia, which is FDA approved and recommended in children aged 9 through 16 years old with previous dengue virus infection and living in an endemic area such as Puerto Rico. There's also the TAC-003 vaccine, which is licensed in several countries, and the Butantan DV, which is highly effective in early phase 3 results. Next slide. There are also many personal preventive measures that we recommend. This includes the use of insect repellents. We want you to make sure these insect repellents will contain these different ingredients such as DEET, picaridin, IR3535, oil of lemon eucalyptus, paramethanediol, or 2-undecanone. You can also use clothing, especially in times of high mosquitoes, such as dawn and dusk, or anytime, including long pants and long sleeve shirts with socks and shoes. Next slide. When you travel, there's additional options which you may want to consider. Always applying an EPA-registered insect repellent using clothing that's impregnated with permethrin. Also, the use of bed nets when you go to areas where there's lots of mosquitoes can be very effective. Now, you want to use these protective measures while you travel and then 3 weeks after you get back. This is because if you get back and you are incubating or symptomatic with the virus, then if a mosquito bites you here locally, it can pass the disease on to others. Next slide. We ask that everyone control mosquitoes both indoors and outdoors. This would include items such as putting screens on your windows and doors. Also making sure that there's no standing water in your home and yard, including emptying swimming pools, portable swimming pools, buckets, planters, and generally surveying your yard for any standing water that could be there. Some mosquitoes have been shown to breed in very small amounts of water, even the amount of water that could collect in a bottle cap, for example. Next slide. And you are fortunate, you are going to hear from one of our local vector control districts, but here is a map that shows you all 5. In LA County, we have 5 vector controls. We have one in the Antelope Valley, the Compton Creek Mosquito Abatement District, Greater Los Angeles Vector Control District, San Gabriel Valley Mosquito and Vector Control District, and finally the Los Angeles West Vector Control District. And you can see a map of Los Angeles here with the different vector areas in different colors. And speaking of districts, next slide. We thank you. You can go to our website for more information. You can see them here on your screen. And then I'd like to turn it over to Jason.
Apologies, Jason. I believe you're still muted.
Oh man, all of that good stuff wasted. All right, let me start again. Thank you, Dr. Terashita, for the introduction. My name is Jason Farned. Good evening, everyone, and thank you so much for having me. I serve as the district manager for the San Gabriel Valley Mosquito and Vector Control District. And tonight I want to give you all a brief introduction into the ways mosquito and vector control programs help to protect public health. And as you just saw, the San Gabriel Valley Mosquito and Vector Control is just one of 5 independent special districts that provide vector control services in Los Angeles County. All operate independently and have unique programs and services, but the way we approach mosquito and vector control is fairly universal. So while I'm on the call here discussing specifically the San Gabriel Valley Mosquito and Vector Control District, much of what I'm going to talk about is going to be consistent with all the vector control districts in your area. But if there is anything that you hear from me today and you live in the jurisdiction of another district, you should check in with your local district to make sure that all the information is the same. Next slide, please. All right, let's dive in with this fun fact. Mosquitoes grow in water. They need standing water or stagnant water to lay their eggs and grow. And if we can eliminate or properly manage the sources of water they need, we can reduce their population. And so on the right side of your screen is the mosquito life cycle. And let's run through it really quickly. It starts with a female mosquito, and she needs the protein from your blood to produce eggs. And here's another fun fact. Only female mosquitoes bite. So the female mosquito bites an animal or human, gets some blood and makes some eggs. And next, she's going to need to find a place to lay her eggs. And so once she finds stagnant water, lays her eggs, the eggs hatch out into the water and the baby mosquitoes swim around for about a week or so before emerging as adults. And so as you can see here, 3 of the 4 stages of a mosquito's life take place in water. And this really is the best time and place to eliminate them. Once they become adults, it's a little more challenging. So most of our control efforts focus on the aquatic stages. Removal and or proper management of standing water is really the key. Next slide. And this is important because mosquitoes are the world's deadliest animal. They are responsible for more human death every year worldwide than all other animals combined. And so as we already heard today, here in LA County, we do have mosquitoes that can make us sick. And so I also wanted to highlight the same 2 important species. So on the left, we have the Culex mosquitoes that were already described. There are native mosquitoes and probably the most abundant in your neighborhood. And they spread diseases like West Nile virus and St. Louis encephalitis. West Nile virus, again, is the most predominant mosquito-borne disease in our area, and it is endemic in California, which means that it's always here in the environment and it never really goes away. And on the right side, we have the Aedes mosquitoes. And as mentioned, these are an invasive species that were introduced to our area about 10 years ago. And they are very aggressive biters. They bite anytime throughout the day. And they actually prefer to live close to humans. And are mostly found growing in backyards. And so they spread diseases that California didn't have to worry about before their arrival. Diseases like dengue, Zika, and chikungunya. And while none of these diseases are currently being spread by our local mosquitoes, that can quickly change, as you heard, if an infected traveler introduces one of these viruses to our local population. Next slide. So what can we do about it? Well, for our part, the district uses a data-driven method for controlling mosquitoes and preventing disease. The method is called integrated vector management, and it includes a combination of efforts, including public information and outreach, surveillance and data management, and prevention and control. Next slide. Our public education and outreach is the foundation of our program. Our communications department is made up of credentialed educators, content creators, and outreach specialists who participate in communities' fairs and events, provide essential information to residents, create multilingual educational material, and conduct curriculum-based classroom education programs for K through 12 students. Next slide. Our surveillance department is made up of scientists and field entomologists that collect mosquitoes from over 80 trap sites throughout the district. They measure abundance and test samples for the presence of disease. They also analyze critical data that they provide to our other departments to ensure the most effective use of our resources. Next slide. And finally, we have our operations team, which works in the field to find and eliminate standing water. consult residents about mosquito exclusion and bite prevention, and perform chemical and biological control treatments. Our data management program, which can be seen in the image on the top left, tracks known mosquito breeding sites and disease activity and provides real-time data to our field specialists. Next slide. The district also tracks disease. So when we track West Nile virus in mosquitoes and birds, and we respond to positive cases with additional control measures. And so when a concentration of virus is found, as seen in the graphic here on the left, the district escalates its response to meet the increased risk to public health. And increased surveillance and control measures are used, including targeted neighborhood support, truck-mounted pesticide treatments, and public outreach to quickly decrease the mosquito population and alert residents of the potential risk. Next slide. Mosquito control is a shared responsibility, and as I mentioned before, much of the mosquito breeding does take place in backyards or on private property. And so we also provide property consultations and create unique mosquito management plans for residents so that they can prevent mosquitoes from growing in their own backyards. We also encourage residents to submit a tip on our website when you see any standing water in your communities. Next slide. In conclusion, we encourage everyone to tip, toss, and protect. Tip stagnant water from containers weekly. Toss unwanted and unused containers, and protect yourself from mosquito bites by using the EPA-approved insect repellent and protective clothing. A mosquito repellent remains the most effective way to prevent mosquito bites and prevent mosquito-borne disease. And so we encourage residents to repel mosquito bites safely and effectively using the repellent with one of the 4 CDC recommended and EPA registered active ingredients. And again, those are DEET, oil of lemon, eucalyptus, picaridin, and IR 3535. And you can always find the active ingredients on the front of the bottle. If residents would like to get more involved in their own neighborhoods, engaging their neighbors, here in San Gabriel Valley, we have a neighborhood watch type program called Bite Back Champions, and you can find more information at bitebackchampion.org. And then for more general information and resources, please go to our website, sgvmosquito.org. And if you're not sure what district you belong to in Los Angeles County, you can always go to our website and there's a search tool there that will tell you which district represents your area. And again, that's sgvmosquito.org. Thank you very much. That concludes my presentation. And I think we're ready to open it up with some questions.
Thank you to our speakers. Again, if you have a question, please enter it in the chat on YouTube, Facebook, or respond on Twitter/X. Our first question is for Jason. Why do we even have mosquitoes? Is there any kind of benefit to mosquitoes?
Well, the short answer is probably no benefit, but of course it's much more complicated than that. Mosquitoes do exist as part of the Earth's complex ecosystem, for better or worse. And so we need to respect that. And from a human perspective, they wreak a lot of havoc, but they are part of the food chain. And some species are considered pollinators. Now, exactly how critical they are to those systems really depends upon the specific environment. It's really argued that many places wouldn't miss them all that much.
Thank you, Jason. And our next question, are there any new technologies being used to control mosquito populations, either within San Gabriel Valley or nation or worldwide?
Yeah, there are. Over the last several years, there's been an incredible focus on sterile insect techniques, or SIT. This is a technology that uses sterile male insects to reduce a local population. It's been successfully used in California since the 1970s to control the Mediterranean fruit fly. In fact, California releases millions of sterile medflies every year. And so now they're starting to find ways that they can use this technology in mosquitoes. So recently, research has seen a lot of success using this technique to control Aedes aegypti mosquitoes, the primary vector for diseases like dengue and Zika. And there are three different ways that you can sterilize a male mosquito. Wolbachia, which is a naturally occurring bacteria, gene modification, and irradiation. And so here in California, there are several vector control districts that are exploring the efficacy of Wolbachia and irradiation. Our district is currently developing a program so that we can add these non-chemical tools to our toolbox as soon as they become available.
And one more question for you, Jason, and I think Dr. Halai might be able to speak on this from a county perspective. How do each of you, either in San Gabriel Valley or in LA County, how do you prioritize areas for mosquito control efforts?
That's a really good question. I think it's important to remember that our primary objective is to protect public health by preventing mosquito-borne disease. And so everything that we do is measured through that lens. It's also important to remember that mosquitoes are an inevitable part of our environment. Nothing that we can do at this time can completely eliminate them. So we're stuck with mosquitoes, and as in the case with West Nile virus, we have the virus in the environment. So we prioritize our efforts really by doing three things. First, understanding our environment. We need to know what normal looks like so that we can quickly and accurately identify red flags and opportunities. Next, we need the most current data to make sound decisions and prioritize responsibly. So our surveillance department is out in the field gathering data on a daily basis that we use to make decisions. And then third, we need to engage with our residents and our healthcare partners so that we can share information. Once we have all the information, and by doing these three things, we can really identify and prioritize specific areas or situations that pose an increased risk to public health.
Dr. Halai, anything you'd like to add from a countywide perspective?
Yeah, I just want to echo Jason. In public health, we often talk about using data to inform action. And so, what Jason, talked about, that it's about doing surveillance, monitoring, at a mosquito level, monitoring the mosquito abundance, mosquito infection. And then at the human health level, we are looking at the cases that are coming in, reported to the public health department, investigating those cases. And then when we look at those cases on a geographic level, and then we share the data with our vector control districts on a need-to-know basis. And then using all that data from all those different sources. So and then there's also dead bird surveillance, right? There are also horses that are reported. And so we compile all this data and then kind of look at, okay, this is what we expect activity to be. Is the activity on par? How do we control that further? And then look for increased activity. Is there an outbreak in a particular area that we need to focus on? And then if that is identified, then we take more action. So we will involve our vector control districts who are on the ground, really controlling those mosquitoes, informing the people on the ground. And then we work with our healthcare partners to increase their suspicion for disease. So there's a lot of different things coming together to formulate a response depending on the situation.
Thank you, Dr. Halai. This question is either for you again, Dr. Halai, or perhaps Dr. Terashita. What mosquito-borne diseases are most common, let's say, in a specific area like San Gabriel Valley, and then I guess just in LA County in general as well?
I can take that one. So, as we've talked about, West Nile virus is probably the highest concern for us on an ongoing basis, because we have West Nile virus activity in the environment. It's endemic. It's expected every year. We expect humans to be infected each year. To some extent, we also expect people to die from West Nile virus every year, and that's just unfortunate. And it just from a numbers perspective, those are those have been the trends, right? And so that we always want to be focused on that. Hand in hand with West Nile virus is St. Louis encephalitis virus, which is very similar to West Nile virus. And it used to be present in our environment many years before West Nile virus came along, and then seemed to be shifted out. And then West Nile virus came over and took over a lot of the activity. But at this time, we have St. Louis encephalitis virus sporadically transmitted, and sometimes we get cases, but that is considered endemic as well. So it's present in our environment. And then this year, particularly, we're concerned with dengue because we are concerned that there will be travelers that are infected abroad that will come back here, get diagnosed here, or maybe not even diagnosed here. But there's that risk that a local mosquito will bite that infected traveler and then potentially bite another person. And if we don't detect that local, resident who hasn't traveled, it just creates this cycle, and we don't want to get into a situation where we have a large outbreak of a disease that is not commonly transmitted here. In previous years, we were worried about Zika, but now that activity has gone down globally. And so right now, West Nile virus, St. Louis encephalitis virus, sort of ongoing concern. But right now, given the global trend in dengue, we're concerned about dengue virus as well.
And Dr. Halai, I might also add, worldwide is quite a different picture than what we see here in the United States. So dengue, as Dr. Halai just mentioned, is very common worldwide, as well as malaria, which might be the most common mosquito-borne or mosquito-transmitted disease in the world. We're still seeing that in other countries, not here in the United States. And we're, as Dr. Halai mentioned, very worried that some of the what we consider travel-associated mosquito-borne diseases will come here, whether because of the temperature that's changing here or whatever, more travel. We are seeing more cases of non-travel associated dengue in both other areas of the country as well as here in Los Angeles. So it's a good time to remember mosquito avoidance, mosquito repellent, and monitoring yourself when you travel.
Thank you, Dr. Halai and Dr. Terashito. We do have a couple of questions that were entered into the chat. I imagine this may be for either Jason or perhaps Dr. Halai or Dr. Terashito. Is there some kind of yard spraying I could do that would kill mosquitoes but not harm beneficial insects like bees or butterflies?
I can start with that one. There are a lot of options available, at your local hardware store. Nothing that the district would recommend or endorse, not because they're not good. It's just everyone has to kind of make a decision for what they're doing in their own home. So my recommendation would just be to read up on the products that you want to use, and then it's really important that you read the label and follow the instructions very carefully. It's really difficult to control adult mosquitoes with pesticide without harming beneficial insects, because beneficial insects are, similar size. They hang out in similar places. And so really pay attention to the label if you're looking to protect beneficial insects when you're using anything that will target adult mosquitoes. A much better way to control mosquitoes in your yard is to control the standing water and to find where the mosquitoes are growing. Anything that's going to target adult mosquitoes is going to be very short term. If you don't find where the source of where they're coming from, when you kill the adults, the very next day, more mosquitoes are going to be emerging and that population will be replaced very quickly. And so the best way to do it is spend a little bit of extra time and a little bit more work really looking to find the sources of standing water that's creating your problem and target that instead. There are pesticides that you can put in water that target immature mosquitoes that are much more target specific and will not harm beneficial insects. So I think that that's a much better option. And that's also the course of action that we take district-wide as well.
Another question, and I'm not quite sure if we could answer this, but I'm curious if anybody has any recommendations for folks to reach out to. is we received multiple questions asking if landlords are required or mandated to provide screens, screen doors, screens on windows that can help prevent mosquitoes from traveling indoors.
I'm not sure.
Yeah, that's a really hard question. I think that would depend on the local sort of regulations, and that might also vary from one city to another. So I think that yeah, we need to look that up more.
Another question that we have in the chat: are there any plants that we could plant to help keep mosquitoes away?
Yeah, there are a lot of beneficial California native plants that will help with mosquitoes. A quick internet search will give you the full rundown. But the traditional things, lemongrass, eucalyptus, things like that, are good candidates. Mosquitoes like to rest in foliage. And so while one plant isn't going to keep the mosquitoes out of your entire yard, it won't be a good environment for mosquitoes to rest. And so if you have enough of these plants or you're sitting in close proximity, it might help, but it's not going to be an end-all be-all solution. It's just going to have to be one of many things that you do to keep mosquitoes out of your yard. And you know, the more steps that you can take, the better.
We received another interesting question in the chat. I'm curious about this as well, as somebody who's never bitten by a mosquito, but my wife is constantly chewed up. Are mosquitoes attracted to certain blood types more than others?
That's a tricky question because I've heard so many different answers over the years. So I'll defer to my public health friends here. If you guys have a specific answer, if not, my answer would be I think it's not definitive. No.
Yeah, this is a common question. I think there have been some studies that have come out saying that there's particular blood types that mosquitoes prefer, namely O blood type. But then other studies have refuted that and said there's no link between blood types and attractiveness to mosquitoes. So I think that there are other well-established sort of things that are known to increase mosquito attractiveness, and they're linked to some volatile compounds that on the skin, such as like skin odor, sweat, body temperature, blood alcohol level, all those things that play a role in how yummy you are to a mosquito, not necessarily the blood type.
Thank you, Jason and Dr. Halai. Another question in the chat: would hanging UV fan traps, UV lights or fan traps, be an effective way to combat mosquitoes?
It can be. There are different lighted traps. Light isn't the most effective way to attract mosquitoes, or isn't the only way to attract mosquitoes. So there are some lighted traps out there that will catch all kinds of insects. In fact, you might trap more other insects or beneficial insects than you would mosquitoes. Mosquitoes are more attracted to scent and the CO2 from our breath. And so a lot of the traps that we're using out in the field in this area have to do with stagnant water, smelly water that attract gravid female mosquitoes, or CO2 to emulate your breath to try to attract mosquitoes that are host seeking. So there are a lot of different traps out there. The lighted traps are hit or miss, I think.
We have another question here, and either for any of our panelists. How or do we know if climate change is impacting mosquito-borne diseases in Los Angeles County and around the world?
Go ahead, Dr. Halai, you want to take that one? I'm happy to. But...
So the short answer is that that higher temperatures are more conducive to mosquito transmission, viral transmission by mosquitoes. And Jason can talk about the specifics, but we do expect that as temperatures rise, we will see mosquitoes in places that we haven't seen before. So their geographic sort of spread will be more expansive, and we will likely see more cases because of the various effects of high temperature on mosquito abundance, as well as their ability to transmit different infections. I will pass it over to Jason, who's our expert on this.
All right, yeah, mosquitoes grow in water and the water needs to be warm. They really thrive in humid environments. And so, of course, extreme or unpredictable weather plays a key role in mosquito development. And so I think climate change impacts mosquito-borne disease in a few ways. First, it makes our local mosquito season a lot less predictable and more difficult to manage. For example, mosquito season here in LA County is getting longer. We're seeing mosquito activity now as early as March and continue all the way through October, sometimes November even. Second, climate change is allowing invasive species to get a foothold in places that may not have been hospitable to them in the past. And so as the weather changes, species tend to be able to take a foothold around the world in new places. And then finally, I think when we're seeing extreme weather around the entire planet, it contributes to mosquito-borne disease outbreaks. And even though that these outbreaks are happening on the other side of the world, because of global travel, the increased disease activity in other parts of the world can mean increased risk for us here in LA County. So, for example, with the dengue outbreak, a lot of it was attributed to a really extreme, elongated monsoon season. And so even though we don't see the direct result of that weather here, because that is promoting mosquito activity and disease transmission so far away, people traveling to and from that area then can become carriers and introduce that virus to our local environment.
We have another question in the chat. It appears that it's a little specific, so I'll open it up to Jason or Dr. Tereshita or Dr. Halai. Mosquitoes are very bad along the foothill communities. Are there any plans for addressing these areas a little bit more directly?
Yeah, mosquitoes, we have two issues with the foothill communities. One is that there's a lot more wild spaces, a lot more rural spaces, and then we also have a lot more natural sources of water. And so those areas are much more difficult for us to manage. So that's number one. And number two, we also have black flies in the foothills of San Gabriel Valley that often get mistaken by mosquitoes. They're a small biting fly. And the district handles all of those as well. And so really the district monitors mosquito and black fly activity throughout the entire district. And with our limited resources, we really prioritize those resources in place where the disease risk is the highest, because our first priority, first and foremost, is to prevent disease transmission. And so if you have a lot of mosquitoes in your area, more than usual, we're always going to have a baseline level of mosquitoes. If you have more than usual, then there's probably something additional that's happening that's not normal in your environment. And that's definitely something that the district wants to know, and we can come out and investigate that and try to find a permanent solution to that issue. And so please reach out to the district, submit a tip or request a property consultation, and we'll come out. We'll go through your property specifically. We'll walk through your neighborhood specifically and look for anything out of the ordinary. We can also provide you with a mosquito management plan for your specific property so that you can manage mosquitoes long-term and reduce populations as much as possible. But there are, the baseline mosquito activity, so for some communities is just higher than others. And really what we're looking for is that combination of high mosquitoes and disease activity where we prioritize our resources.
Thank you. That's great information. We have a question for Dr. Tereshita. Can you talk a little bit about the process for notifying notifying the public about mosquito-borne disease outbreaks?
Thanks for that question. I can start and Dr. Halai can finish. Yeah, so in public health, our job is surveillance and investigation. So we look for cases of mosquito-borne illness and we track them over time. We look for clusters, and if we identify anything unusual, we will investigate. So I guess the question was about outbreaks. Each of the different mosquito-borne diseases has a different definition that we use for outbreaks. And some of this information can be found on our website under the specific disease. So it will depend. It will depend on if we have a few cases of West Nile virus versus a single case of non-travel related dengue would be what we consider an outbreak. So it depends. When we do find an outbreak or we learn of an outbreak, we do an investigation, which would include interviewing cases, conducting case finding, going to the area, looking at the environment, looking for other people who may have been exposed, passing out education, educational materials, and even perhaps, depending on what we find, involving vector control to take a look at areas of mosquito breeding, or other vectors. So it really depends, but yes. Our job is to notify all those who are at risk.
Absolutely. I think Dr. Terashita covered it. I think so an outbreak is, it depends on the situation. So, if it is a closed environment and there are many cases in that environment, that will be an outbreak. For West Nile virus, it's a little bit more fluid because we get cases every year and there is activity. And so, we're constantly monitoring and tracking the cases that we get. And so we map the cases, the residences. We also ask during our investigation from the cases, where they work, where they've traveled to link the cases. And if there is enough evidence that we have, some direct link that suggests that there is an outbreak, then we would take action. We would notify broadly, and we could use if it affects a lot of people, we've used press releases in the past. If it affects a closed environment, then we would just target that group. And then we would work with our healthcare providers as well. And as Dr. Terashita was talking about, for dengue, it's a little bit different because we don't have the cases every year. So even if there was a single case that was locally transmitted, we would react to that pretty quickly, looking for more cases. That's called sporadic transmission. It doesn't get to the level of an outbreak, but the response would be very similar, and we'd be doing a lot of outreach and education if that were to happen.
We have another question in the chat for either Dr. Terashita or Dr. Halai. Is testing for these diseases easily available? What should we do if we suspect we are infected when there is no treatment or vaccine available?
Yeah, great question. So, it's really a discussion to be had with your healthcare provider. And so the tests are widely available. They're available at commercial labs. And so your doctor can easily order them. But depends on, their clinical decision making, depending on what symptoms you're experiencing, what the risk is, and they will then, make that decision to get the testing. And then the type of testing to order will be that discussion with the healthcare provider. And we're constantly in communication with healthcare providers, trying to educate healthcare providers so that they know how to test for a certain disease. And there's enough information really available online as well. And so the healthcare provider will then make that decision depending on your symptoms and your risk, whether to test or not. But really, from a patient perspective, I think the key thing is to recognize the risk. So, if you've traveled somewhere recently or are planning to travel somewhere where there is activity, and if you come back and you have symptoms, go to your healthcare provider and tell them, this is exactly where I traveled. I was exposed to mosquitoes. I'm concerned about my risk. And that will sort of prompt them to think about it and order that testing. Even if you haven't traveled and you have a lot of mosquito activity at home and you're not sure what's going on, you have symptoms, go to your provider and tell them that you have mosquitoes at home, you have been bitten by mosquitoes, and that will get them thinking about getting you tested for it.
One more question, a little bit about the disease aspect of it. What are some of the, if there are any, long-term impacts of getting a mosquito-borne disease?
Yeah, there has been a lot of studies that have shown long-term impacts from West Nile virus infection, so especially the neuroinvasive type, right? So that causes meningitis, encephalitis, especially with encephalitis, and also acute flaccid paralysis, which causes paralysis of the extremities. There's can be a long recovery period, especially older individuals. They can have cognitive impairment, so like slowing of like their thought processes, slowing of movement. They could have other sort of less prominent signs and symptoms lasting several months to years. So the long-term complications are a real concern. With dengue, one infection is a risk factor for severe disease with another dengue infection. So that itself also is kind of, you think about, well, the first one might be mild, but that just increases the risk that the second time the infection occurs, it could be severe. Although, as I said, any infection could be severe.
Yeah, I think I'll add a little. It really depends on the disease, because we seem to be focusing on two of the mosquito-borne diseases, West Nile and dengue, which both can have long-term effects, as Dr. Halai has mentioned. But there's a lot of other mosquito-borne diseases like Zika, which was really endemic or epidemic a few years ago and had a lot of very severe long-term effects, especially in babies. There's also chikungunya, which can have a lot of different, even different long-term effects, such as arthritis. Malaria has endless long-term effects. So it depends. And a lot of it's on our website. You can also speak to your physician if you're concerned.
We maybe have time for one or two more questions. One more that we did receive in the chat. What can we do about neighbors standing water if we see them have it? We've tried to talk to them multiple times about this, but they don't seem to be doing anything.
Yeah, so it's definitely something your local vector control district is going to want to know about and will investigate. And so all of the districts have some way to contact them, whether it's a service request or a tip line. In the case of our district, you can submit a tip. It can be anonymous if you like. Just let us know what your concern is, and someone will go out and investigate. It is a violation of the Public Health and Safety Code to have standing water on your property that's growing mosquitoes. And so pretty much any place where standing water is being left for more than 3 or 4 days and allowed to grow mosquitoes is a violation of that code. And so we can come in and let them know and try to eliminate those sources as soon as possible and hold the resident accountable. But we also know that or want to work with residents. We want you to be our partners in the community. And so if you are a resident that has a non-functional swimming pool on your property or has an old fish pond that isn't working, call and let us know, because we want to work with you while you're trying to fix it long term. Ultimately, we want you to permanently fix the issue so it's not a problem, but we can manage the site temporarily to make sure that it's not growing mosquitoes while you're getting that repair done, or while you're eliminating that fish pond or bird bath or whatever it is. So both as a neighbor, call and let us know, but as a resident, if you have standing water in your property, call and let us know that too, because we can work with you and help you get rid of it.
And I think our last question, and I'll open it up to the entire panel. What educational resources are available to the community about mosquito prevention and control?
All right, I'll start. I think starting on our website is the best thing to do. Our website has all kinds of digital and printed resources with different languages that help you identify mosquito sources and help you protect yourself from mosquito-borne disease. We are also out in the community quite a bit. So a lot of community fairs, a lot of summer events. You'll find our district out with a booth. So anytime you see us in the community or see our booth, come up and chat. You can ask specific questions about your situation or get educational material. And then we have a very robust education program, our eco health program, where we have tailored grade specific curriculum for preschool, pre-K, all the way through 12th grade. And so we work with local school districts and local teachers to put some of these programs in the classroom to help kids learn about mosquito control and disease prevention.
That's great. Thank you. Oh, sorry. Go ahead, Dr. Terashita.
Oh, thanks. Sorry for interrupting. I was just going to add, we in public health, we have a lot of resources for the public, but we also have a lot of resources for like healthcare providers as well. Most people are diagnosed by a healthcare provider in some capacity. So we have a lot of guidelines out there and resources for those of you who are healthcare providers or want to tell your healthcare provider to contact us.
Thank you, Dr. Terashita. I want to thank our panelists for providing such great information, and to all of our audience members for sending in some really great questions as well. I want to give an opportunity to our panelists just to provide some brief closing remarks. I think I'll go in reverse order from how we spoke earlier. Jason, any closing remarks on your end?
I think I will just echo the tip, toss, and protect. So just check your property as much as you possibly can to get rid of standing water. I guarantee you go out there long enough, you're gonna find something. So please go out, find your standing water, eliminate the containers, get rid of it permanently, and then wear mosquito repellent. This time of year, it's so important to wear mosquito repellent. If mosquitoes aren't biting you, there's no risk for mosquito-borne disease. So don't let the mosquitoes bite you. Keep them outside and wear repellent when you're near them. Other than that, I just want to thank you and LA County for allowing me the opportunity to speak today and answer some questions. I really appreciate it. Thank you very much.
Dr. Terashita.
Jason said it all, but I was going to echo the part about the wear mosquito repellent, practice mosquito avoidance, make sure you dump all that standing water in your yard, and whenever you go outside, wear mosquito repellent. I always do. So probably the best thing you can do to protect yourself from mosquitoes.
Dr. Halai.
Hi, thank you. If you saw my child, I'm sorry, it's 7 o'clock and they kind of were not supposed to come till 7. But I just wanted to thank everyone for being on the call with us and for your interest. And, this is the first step of getting educated. And thank you for spending some time listening to us, and I hope that it helped. Thank you.
Thank you to our speakers, and thank you to our audience members. Once again, everyone, have a good night. This concludes our virtual town hall.